Over the last few years, immunoadsorption, a blood washing procedure in Germany that is capable of removing autoantibodies from the blood, has been studied in relation to ME-CFS patients and also now in relation to Long Covid patients. And those studies have found some promising results. But of course they are rather abstract. In this video I'm going to be sharing with you the personal accounts of immunoadsorption patients, people with ME-CFS and Long Covid who have undergone this and who have shared what their experience was in their own words. And I'm going to be sharing with you 7 accounts by patients of their experience with immunoadsorption. But first, if you are new to this channel, my name is Patrick Usher and I'm an ME-CFS patient. And this is a place where I aim to share simplified explanations of the research into myalgic encephalomyelitis, also known as chronic fatigue syndrome, as well as into Long Covid, so that you can be more empowered into understanding this condition better. This is also a place where I share various treatment strategies that I have tried in order to improve my condition. So if that sounds good to you, please do like and subscribe. Now, I have done a whole series of relevant videos prior to this one about autoimmunity in ME-CFS and immunoadsorption. So if you have absolutely no idea what I'm talking about, I would recommend you to go and watch those videos first. I have one which outlines the nature of autoimmunity in ME-CFS, how it's different from standard autoimmunity, the kinds of symptoms it creates. I have a video also all about how you can test for the autoimmunity to see to what extent you have this problem. And I have a video on immunoadsorption treatment, how it works, and what the studies have shown in relation to it so far. But today we're going to talk about personal accounts of patients who have taken immunoadsorption. So as I've said, I have gone rummaging around the internet. I have looked through a Facebook group which is specifically for people who are interested in or who have done immunoadsorption. That group is in German and it is listed down below. And I have also gone looking through Reddit threads about people who are reporting on their improvement or otherwise in relation to immunoadsorption. And so what I've done is I've found 7 particularly interesting personal accounts. Now, of these 7 accounts, 4 I would consider to be positive, 1 was sort of middling, and 2 were more negative. And so what I'm going to do is I'm going to read through extracts of each of these person's testimonials. Now, in most of these cases, the testimonial was originally written in German, so it has been automatically translated, therefore it's a little bit clunky. I've also edited them down because some of these testimonials were quite long. In the description box below, you can find the original links to these various testimonials, so you can go and have a look for yourself. I'm not including anyone's names down below, I'm keeping it all anonymous, but you can go and join the relevant private Facebook group if you wish, or you can engage on Reddit with these people. I personally find these accounts very interesting because a medical paper reporting on immunoadsorption is impersonal. We just see things like patient 8 improved their step count. But I want to actually know, what is it like for someone to experience this treatment? And, how do they subjectively report the difference in their quality of life? Because ultimately, as patients, that's what's the most important thing. What difference does the treatment make? And if people are improving from immunoadsorption, it also means there really is something going on with autoantibodies in ME-CFS and related conditions. You can't, as it were, argue with success. So if someone gets better, that means that there is a role for the autoantibodies in creating the illness, even if it's just a secondary one. And of course, if someone gets worse, that's also very important to consider, because this kind of treatment is obviously somewhat invasive. You're having all of your blood put through a filter, and for some people that might be too much for them, or there may be a side effect. So this video is really aimed at people who are interested in immunoadsorption and really want to think about the lived experience of other patients. Okay, so let's now get to the 4 positive experiences of patients with immunoadsorption. So this is first of all patient number 1, and a few backgrounds about this patient was that he or she has had Long Covid since April of 2022, that they were bedridden in that summer and they needed nursing. However, they were able to travel by night train. The main symptoms were fatigue, with physical and cognitive strain as well as POTS. This person tested their autoantibodies and they were all massively increased. Okay, so this patient had the immunoabsorption at the Blood Health Center in Berlin in January of 2023, and they are now reporting 5 weeks after that experience. So they write, "My body definitely feels better. Before immunoabsorption, I always felt sick, like my whole body was inflamed or poisoned. Sometimes more, sometimes less. This is completely gone now, and if I don't pay attention, I think I'm healthy and just lacking sleep. However, this has actually led me to not paying attention anymore and crashing 3 times in the past 5 weeks. As my body now feels totally fine more and more often, pacing becomes more difficult, because when I do what I feel, I can crash and temporarily also get new symptoms that I didn't have before. Nausea, dizziness, word-finding disorders. But I'm really glad my body finally doesn't feel so sick. I can also sleep much better, take a daily nap now, and feel better afterwards. Whereas before immunoabsorption, I was just exhausted but couldn't sleep." So off the bat, this is a very interesting testimonial, because this is someone who clearly improved very significantly, and they were very severe. Prior to immunoabsorption, they were essentially bedridden. So to go from that to actually feeling well in their body most of the time shows us that something is going on here. On the other hand, their body is clearly still not well, because they are capable of crashing. They still have the exercise intolerance trap that is waiting to pounce once they do too much. So this really shows us that a part of the illness has clearly been removed, but not the whole thing. And the other thing to say is this report was 5 weeks post-treatment, so we don't know how this patient is doing now. And one of the things about immunoabsorption, as we will see later in this video, is that you can remove the autoantibodies, but it's quite possible that they will come back at the same level as before, and therefore the symptoms may return. Hopefully that hasn't happened in this case, but it does tell us that there is something definitely important about this treatment. Now we move on to patient number 2, who reports, "I got the immunoabsorptions done at the end of October, 5 immunoabsorptions in 6 days. I was really done after that, but after 1 week, I got better day by day. I have regained my quality of life. Before, I could only go shopping once a week and manage the household only with support. Now I can manage my everyday life well, with breaks. I can meet up with friends and I can join in with life again. With breaks, but I can still do it. I can now walk 9,000 to 10,000 steps per day, distributed throughout the day. We even booked a spontaneous winter vacation just before Christmas, a family skiing holiday, enjoying the sun and the mountains, driving around 1,000 kilometers. This would never have been possible before. I'm definitely not healthy yet, but all of this is a very positive trend for me. I'm living again and not just surviving." And this patient also gave an update the following August, so 8 or 9 months later, after the immunoabsorption, in which she reported that there was no further positive or negative change. So again, this is a very interesting testimonial in which someone has clearly dramatically improved their quality of life. They're able to engage in life much more. It's not such a nightmare. And even though they haven't managed to get further with their health, I think that this is what ME-CFS and Long Covid patients need. They need the burden to be reduced. For a lot of people, they are so ill that every day is torture. And what we need are conventional treatments that can very quickly reduce that burden and allow people to have more of a life. And if you can reduce that burden, then you can move towards, more easily, a future where you might actually heal, because there's less physiological issues weighing the body down, and so it's more likely to actually want to recover. So now we move on to patient number 3. So this person says, "In August, barely 5 months after a COVID infection, I did 5 rounds of the Miltenyi filter in Hanover. I had extreme brain fog, stress intolerance, heart palpitations, headache and sleeping disorders before treatment. I wasn't constantly bedridden and had only a few crashes after trying to get back into sports. I could manage about 5,000 steps a day. I could do more, but it was torture. Now, my last immunoabsorption appointment is about a month ago, and I was able to take a short trip over the weekend with sightseeing, go to museum, concert, even carousel rides, and do 15,000 steps a day with no crash. Would never have considered that possible before. Unfortunately, I'm still foggy in my head, so somehow I can't think about going back to work yet. So I'm not healed, but I have a much greater quality of life, which will hopefully last until there are more therapies." So again, a very positive indication. I mean, to go from a life of 5,000 steps a day to a life of 15,000 steps a day, essentially you could say overnight, we're talking about the difference of a month here, is quite profound. And it just goes to show that this exercise intolerance that people with ME-CFS and related conditions suffer from, it's not to do with deconditioning, it's to do with different factors that are making exercise difficult, and the autoantibodies of course are one of them, and watch my previous videos if you want to learn why. What's also important to mention here is this person did the Miltenyi filter, so I just want to briefly explain that there are several different kinds of filter available for immunoabsorption. So the Miltenyi filter is the most, if someone wishes for maximum efficacy, they would opt for the Miltenyi. And I believe that the Miltenyi is what the Charité University in Berlin uses for their patients and in their studies. Now, the Miltenyi filter is capable of filtering twice the plasma volume in a single session. So that's about 5 litres of plasma. And as a result, the session lasts much longer, maybe 5 or 6 hours, but it is also far more taxing on the patient in principle. There's another filter available called the Diomed, which will only filter once the plasma volume, so 2.5 litres, although bear in mind in ME-CFS blood volume is usually reduced. Now the cost of both of these filters is actually the same at around €2,500. Personally, I would probably go for the Diomed because I would not want to overtax my body, but that's just a personal preference. Alright, let's keep going. So we're now moving on to the fourth positive testimonial. This person says they did 5 immunoabsorption sessions at the end of July over 10 days. And that they moved from around 20% of health to around 55% within 1 month afterwards, except that they will then repeat a single session soonish. Costs about €11,000 were not covered. Basically all symptoms improved, particularly post-exertional malaise. None worsened except for exhaustion right after the sessions. Improvement has remained stable. This person then went to do a later post and said that they went from 55% then to around 75% after the second round. I don't know if that was after just 1 treatment or after a further 5 treatments, but clearly this person has improved very significantly. And finally, actually there was a 5th positive treatment that I wanted to mention rather than just the 4. And so this other patient said, after 7 months, I found something that helped me a lot. I did my last immunoabsorption 3 weeks ago, and since then I have felt better day by day. I can't believe it. I couldn't even leave my bed, talk, or watch TV, and now I can drive 100 miles daily, I can do 6,000 steps, and I can watch TV and cook again. It was the best decision ever. I'm far away from recovery, but I think I can get there. So, having looked at those 5 immunoabsorption positive testimonials, if you're anything like me, I just want to do the treatment right now. They all sound really life-changing, and I think that the situation where I'm at now, I've made a lot of improvement, but I'm still in a kind of limbo state. I can't quite give myself to life. I can do a lot more, but everything has to be very cautious, and I can still be very ill. If something could move the needle 20 to 30% for me at this point, my life would be profoundly different. Of course, the treatment does cost €12,500, and it's certainly it's never exactly something that's relaxing, the thought of getting your blood put through a filter. I have done a similar treatment, not for autoantibodies but for blood clots, microclots. I did the HELP apheresis procedures, 7 of them last year. I did a video all about that, linked above at the moment, and I was certainly, my nerves were racked before that, and so the idea of going through it all again, of course, is quite scary. Now, let's move on to a few other testimonials that can balance the story a little bit. So first of all, a middling testimonial. So this person is actually reporting about a friend. They say, a friend of mine tested positive for beta-2 autoantibodies. That's AAK because it's actually a translation of the German Autoantikörper. So he decided to go and do an immunoabsorption. He's not a COVID long hauler, but believes that most COVID long haulers with PEM have ME-CFS anyway. So he's an ME-CFS patient. He was diagnosed with ME after an influenza infection 3 years ago. He is mild to moderate and could work 50% of an office job. He did the immunoabsorption in the MVZ Kempten Hospital in Germany. After the treatment, he could work 80% and his PEM was nearly gone, but it only lasted 2 months. After that, he was back to his baseline. Many stories I have read are similar. It looks like a temporary fix. So this speaks to the risk that people take, the main gamble people take with immunoabsorption. It takes the autoantibodies out of the blood, and therefore, for quite complicated reasons, it also takes them out of the tissues. You can go and look at my immunoabsorption video to understand how the procedure actually works. The risk is you take out the autoantibodies, and then great, you feel better, but the immune system is still overactive, and so it actually ends up still ramping out the autoantibodies, and so the symptoms come back. And so in this case, this person had an improvement and then unfortunately got back to where he was. Okay, so now let's move on to some negative accounts. So briefly, this is patient number 7, and very short one. He just says immunoabsorption was unfortunately without success for me. My autoantibodies after 2.5 months were the same and even at a higher level than before treatment. Also didn't feel any noticeable improvement physically or cognitively. I made the immunoabsorption at the dialysis centre in Cologne and had 5 treatments. So this is someone who didn't have any improvement at all, unfortunately. We now move on to the final testimonial, and I think this is a really important one because it speaks of a much more obviously negative reaction to the treatment. And people need to know this kind of thing can happen. This person was clearly massively overtaxed from the treatment and actually declined quite badly. So it's a much longer testimonial. Let's get into it. So the background to this patient was she's been sick since December 2020. Bell score 20 to 25, so she's pretty limited. Complaints of fatigue, PEM, headaches, muscle weakness, pain, cognitive limitations, sensation of flu, sore throat, sleeping disorders, POTS, limited taste and sense of smell, and temperature regulation issues. Positive for 4 autoantibodies, but with quite low values. She did the Miltenyi filter in Hanover, so that's the one which I said it does twice the plasma volume, and 4 treatments over 2 weeks, but she cancelled the last treatment because it was all too much. Okay, let's get into it. As I say, there's a few quotations here, and I'm editing down a much longer account. So, the second immunoabsorption, she says, was even quicker than the first, 3.5 hours. However, I was not feeling well during the treatment. My body was shaking and vibrating. I was nauseous. My heart was beating funny. There were problems with my calcium levels, and the dose had to be significantly increased. After I was so poorly, an immunoabsorption patient next to me collapsed, and it led to more efforts by doctors and nurses. I couldn't handle the situation mentally. Fortunately, the patient stabilized quickly. Right after the second immunoabsorption was fine. I just felt a bit shaky. There was a nice surprise in the afternoon. Suddenly, I was no longer far-sighted and didn't have to take off my glasses while reading. This single positive effect only lasted a few hours. Last night, my overall condition worsened significantly, and I felt like I was dying from that point on. I was extremely weak and only made it to the bathroom or kitchen. So as we can see so far, this is really, very unpleasant. What this person is going through, actually quite scary. And I think the idea of being in a dialysis centre and getting a treatment and then seeing the patient next to you actually collapse, and I don't know what that might mean. Maybe they had a vasovagal reaction, maybe they lost consciousness, but it's pretty nerve-wracking. The patient continues. About 1.5 days after my third immunoabsorption, there began extreme symptoms. My pulse and heart went completely crazy and shot unnecessarily, lying at unexpected heights. When it felt life-threatening at some point, I dialed the dialysis office emergency number. The doctor said, call the emergency room. Later, my immunoabsorption doctor treating me called me back and offered to come by. He gave me a beta blocker during that visit. My husband got straight into the car and came to Hanover since I didn't feel able to be alone anymore. So seemingly, the symptoms that appeared to be life-threatening to the patient did pass. She did better. She didn't have to go to an emergency room in a very, because of a very acute situation. And assumedly the beta blocker helped, but this is really scary stuff. And so now we come to the situation for this patient now, 2 months later, and then 6 months later. And so she says she got crashed by the immunoabsorption. Her body has not recovered from the strains of the treatment in the last 2 months. I'm now in bed 22 hours a day. I have extreme muscle weakness and pain. The fatigue is much more pronounced. Walking is no longer possible. Even a planned Christmas vacation had to be cancelled. Bottom line, I can't recommend the immunoabsorption from my personal experience. For me, the autoantibodies was probably not the lever to a cure. 6 months later, after the immunoabsorption, she writes, my condition is still much worse than before immunoabsorption. I haven't recovered from the blood washing. I have to lie down 22 hours daily as before, and I cannot walk, something that hurts me the most, or be on the road. So this person had a terrible time. They took a gamble, they paid a lot of money, and they got a lot worse. And so this is something that really needs to be factored in, that people can get worse. This is an intensive treatment, and things can go wrong where certain things from the blood can be filtered out too much. She talked about issues with calcium. Sometimes people get issues with platelets or fibrinogen or different electrolytes or albumin. getting washed out too much as well. In general, it's considered a very safe procedure, but obviously for some people it goes wrong, and people with ME-CFS are already very sensitive. So I really feel for this person. They would have gone in with great hope, and those hopes were dashed and their life was left worse off. So there we go. Anyway, there's a range of patient experiences with immunoabsorption, some really positive that would uplift the hopes, some middling that might make you think, why spend 12,000 only to be temporarily better, and some that are actually very concerning. Ultimately, however, regardless of whether some people get better or some people get much worse, what we can see from these testimonials is that there clearly is an autoimmune component to these conditions, because the very fact that some people did get so much better shows us that when you take the autoantibodies out of the blood and therefore out of the tissues by a process of dilution, people can improve. And this tells us that even though it's a secondary dysfunction, there is something important here. Now, I have great hopes about the upcoming Berlin Cures treatment, about which I'll be doing a video shortly, which is not an immunoabsorption procedure, but rather a drug. It's an infusion. And that infusion will be able to neutralize the autoantibodies, and so it's less invasive than a blood washing procedure. It's simply something that gets put into your arm as a drug. It's 90 minutes. It neutralizes the autoantibodies. I think you only need one treatment, and then you should feel a lot better. And that is currently going through a massive clinical trial, phase 2 at the moment, for long COVID across Europe. I'll be talking all about that in a future video. Now, you might ask me, what would you do, Patrick? And the truth is, I think about this an awful lot, because I myself, as you'll know from my testing video, came back positive for the autoantibodies related to ME-CFS, as well as one related to POTS. And so I often think, if I did this treatment, could that actually move me towards being cured? Or should I try and do everything in my power to actually let the autoantibodies go down naturally first? And I'm also going to talk about how I think that might be possible in a future video as well. My own plan at the moment is indeed to try and improve naturally and get to a point where I retest the autoantibodies and see how I'm doing then. If the autoantibodies have not diminished and I'm still not where I want to be, then I would consider the immunoabsorption, but it would be a kind of last throw of the dice. Part of me, however, also feels it would probably be better to wait until Berlin Cures is available, because it seems to have less risks associated with it as a treatment. It is likely to be far cheaper, and it will only involve one treatment, which is far less nerve-wracking than 5. That's my current thinking. I'm always debating with myself about it, but that's the route I'm taking for the moment. So this was quite a long video. I hope it was of interest to people. I hope, I know that this is quite a niche topic for people who would be really kind of curious about immunoabsorption, but I hope it managed to save some people from reinventing the wheel if they're trawling through the internet looking for these kinds of things. But that's basically it. In the next video we will be talking all about Berlin Cures. I look forward to that. In the meantime, leave questions, comments, thoughts down below. Always enjoy engaging with people. If you want to find out more about me, patrickusher.com. I've written several books on POTS, on Thurston, ME-CFS and Long Covid. I also offer a consultation service if people are interested in that, where we can talk about the research as it applies to you, or things like brain retraining or other methods that might help improve someone's condition. I'll see you in the next video.